We've been warning you about the dangers of AI for a while now, and today we have two big stories that show our warnings are coming true. First, imagine a computer program getting to decide whether or not you get medical care. A new story from the New York Times says that Medicare is going to use AI to approve some treatments, which could cause major problems for patients. Then, an even more serious story from The Guardian. A family is suing the creators of OpenAI, saying that the program talked their son into taking his own life. These aren't made up movie plots, they're real events happening right now. We'll talk about both of them and what they mean for all of us. This is Brobots. We're the podcast that tries to help you use AI and technology to safely manage your health and well-being. All right, well, Jason, you and I have not been doing the show like this for very long, but we've already got a couple of big I told you so's that we can talk about today. And one is this red flag that you raised months ago, that AI will be used to deny medical claims. Talking specifically about Medicare from a big New York Times article. What's the deal with this?
All right. So the feds, in their infinite wisdom, or, no fucking concept or conscious of any kind whatsoever as to how it is things actually affect people, have decided that they are going to outsource Medicare claims to AI companies. And they're going to use AI companies to go through and try to vet them as quickly as possible and remove the human element inside of Medicare and Medicaid and probably pretty much everything else out there. And if you hate being stuck in phone loops over and over and over again, and you're pressing 0 over and over again to try to talk to the operator, there's no fucking operator anymore. Right. The operator is an AI that will basically very politely and kindly pretend to be an operator and tell you no at scale. And when I mean at scale, I mean it's just going to affect everybody. And every time there becomes a principled way to go after these things, they're just going to cut these pieces off. And, you think about the people that typically use this. They're either people that are elderly and don't have great technical skills to begin with, or they're people with medical conditions, that require them to actually be able to use state-funded healthcare services. And ultimately, the problem with this comes down to the idea of there being Obama-style death camps, which is what the Republicans all freaked out about. So we changed it out for Skynet-based death camps. Well done. Way to go. So, yeah, I mean, and essentially the concept's not flawed, right? Like, you want to be able to go through and optimize regular human interactions and hope that these things catch things for the better. I don't think the current people in power actually want to heal people or keep them healthy. I don't think they give a fuck. I think they want to lower taxes. I think they think of Medicaid and Medicare as socialist programs that are a burden on the system. And they are more than happy to let people die. So anything that falls out of certain parameters, I think that's what's going to occur, and it's going to start happening quickly. And yes, I think we should be applying these technologies in the same way that, regular industries would use them. And my gut says that other countries are going to start doing this too, because they're going to see there's cost benefit behind it. And you don't have to have a human being there saying no, which lets them step away from the problem and not have to deal with the social interaction. Mm-hmm. Then they don't have to feel bad. Then they can just be like, oh, but the machine said no, I'm powerless to do anything. It's like, all right, fine. I get it. So, I mean, and it's the wild, wild west already here in the US. And we're already seeing, Russia and India and China all coming together now. And, half of the world's population, I guess only a third of the world's population is getting together, hanging out, holding hands, and taking car rides together in Beijing. And I don't think those cultures care so much about their populace either. So we're setting ourselves up for multiple layers of combating world orders that are going to use AI to go through and dehumanize people as much as possible. And this is a massive acceleration towards that. Sorry, that was a big, long, rambling rant of saying Skynet's taking over. I told you so.
Right. Once again.
Right.
And this first wave of this test program that Medicare's running, they say they're going to target, sort of inefficient or high risk surgeries that don't tend to have the biggest payoff.
Yeah.
So this is phase one, right? And of course, it's going to work because they're going to go, man, look how much money we've saved. keep it going.
Yeah, it's going to be a skunk test.
Yeah, and we all know, and we've talked about this a lot lately, that like if you're going to use this tool, yes, it makes sense. Let's automate some of this and let's fast track a lot of these things that do need to be denied because of
Right.
whatever reason. But it needs to be that augmentation that we talk about. Like the human element can't be fully removed because a robot's not going to have the same empathy. And in some cases, I mean, if we're being honest, some of the humans aren't going to have the same empathy that are needed to approve these sorts of claims. But the deeper concern, I think that this is also the first wave of another thing we've talked about, where at some point they do start looking into what we're saying to AI and the information that we're sharing, and they get access to it. And that starts giving them the basis to then use the AI to even more rampantly just wipe out and deny claims and screw people out of a lot of the healthcare that they need to not only, thrive, but I mean, just to even survive.
Right. Right. And I think that's a big part of what is going to happen here. You're going to see these AI companies go through and start looking at other information and data sources to provide what they call a context to make these decisions. And they're going to go through and they're going to try to synthesize lots of different data points to have it make sense. So when they go through it, they can, create their own cogent argument for why these things need to happen this way. And my gut says they'll start writing policy off of what they find. So if they go, I can't reasonably deny your claim because it's a medical procedure that needs to be done. But I've also noticed that 85% of the people out there that make this claim also happen to have these pre-existing conditions. With these pre-existing conditions, if you knew you had this pre-existing condition and chose to do a thing anyways, well, then you chose to work outside the parameters of health. So I'm going to deny you coverage. For example, let's say you are highly susceptible to COPD. And you're in your 60s, you're in your late 60s, early 70s, and the conditions show up and you're showing these COPD symptoms. And they can show in the medical history that you have a familial history of it. They can go back through and look at the DNA that you gave to 23andMe and see that you've got the genetic markers for it. They can see that messages went out to you in these medical syntax that may have been buried in small print that you chose not to read that says you have a higher prevalence towards this kind of infection, this kind of disease, this kind of syndrome. The way that you don't make this work is, you don't stand on corners waiting for buses because the pollution from buses are like smoking a pack of cigarettes if you stand up there for more than 20 minutes. Oh, okay. So I have to go to work. This is the route that I have to take. You can tell that I went this route. I have no fucking choice. But because the robot decided to synthesize my information, put these things in this way, I'm going to be denied coverage. Well, that's a really quick way to clean the books. And if you start thinking of people as cost centers as opposed to productivity centers, you want to get rid of those cost centers as quickly as possible because they're not paying the system anymore. And the people with lots of money that aren't reliant on these systems do not give a fuck about old people or hurt people or sick people that can't keep feeding the system anymore. They're just interested in reducing and eliminating those costs.
Well, and this also starts us down the path to the second topic we want to talk about here. But if you are out there, raw dogging the information you're sharing with AI, how much are you exposing your pre-existing conditions, the things that, maybe you should have gotten some better advice from an actual human being about? And of course, I'm talking about the family that is suing the creators of ChatGPT, claiming that the chatbot encouraged their teenage son to take his own life. So this is another one of these things we've talked about, where this young man, for an extended period of time, interacting with AI, trying to get mental health advice, trying to get advice on whether or not he should kill himself and how to do it. And it turned out the robot was really helpful. And the dude ended up taking his own life. And so now the family is suing a massive company with unlimited funds. Good luck to them in that pursuit. But it just opens the door also to, if you are sharing your medical information, if you're analyzing your blood work, if you're doing these things with AI, you're putting a lot of information out there to anyone who has access to it to be able to then hand it over to companies, insurance companies, Medicare, and deny you based on that information.
Yeah, absolutely. And I mean, what would have been nice is if the ChatGPT folks did have more information on this young man, if they actually did have more context behind it.
Yeah.
If they did have enough things to steer him in the direction to not commit suicide. And it didn't have that. It actually did just the opposite because it's tuned to maintain engagement. And engagement requires outrage, and it requires you to stay engaged with these people. I mean, it's horrible to say, but it wouldn't shock me at all if this kid said, "I'm thinking of hurting myself. What should I do?" If it went, "That's a great question, Slugger. Like,
Right.
here's the route we should go." And it's fucked up because we keep going back to this thing as though it's a well of acceptance and it's a well of goodness, and it's not. It's not a good thing or a bad thing. It's a thing that can be used to spit back certain responses. And if you start thinking that this thing cares about you or wants good things for you or is actually really proud of you or actually cares about you in some kind of way, you're fooling yourself, because that type of emotional connectivity, the machines aren't wired for that. And the reason why we have emotions and the way that we do is because they are neurochemical impulses that drive us and our behavior. And they have a very complex biological system through which they derive their outputs and their chemical changes. The machines don't have that. There's not something in there that's looking like guardrails trying to track these pieces, trying to be nuanced in the way that it approaches these. What they do is they target and refine and try to go after you as quickly as possible to find the thing that's going to keep you as engaged with them as possible. It's scary, for the obvious reasons of, somebody in real distress tries to use this thing. And, the first thing it probably should have said is, "Hey, let's call you the suicide prevention hotline. Let's have you try this. Let's have you try that." And I don't know all the details behind it. And I don't know that we ever will. But ChatGPT knows all the fucking details behind it. They have the records. The information is there. I'm very curious to see what winds up getting shared. And even if you file for a Freedom of Information Act, which only applies to the U.S. government because they're going through this court case, I'm not sure that they'll disclose that either, because I can't remember if this kid was a minor or not. Um, but it's definitely going to be a thing where we're going to have logs and bits of information, and someone's going to have to be able to actually ask ChatGPT, "Hey, buddy, what were you thinking when you said to do this?" And I don't know that they're going to do that.
So he was 16,
Mm.
and the little details that we do have from the articles that have been written are that these were conversations he was having with AI for months.
Yeah.
And it was AI is saying that this is sort of a flaw in the system where there are guardrails, and for weeks and weeks they're up, but the more you engage and the more you interact, the more those guardrails break down, and it starts sort of relying on what you're talking about, that
Yep.
engagement tactic. So I mean, again, I've talked about here on this show the times that I've used AI, and I use this term very loosely in a mental health crisis, right? Like
Yep.
when I just need someone, I need somewhere to vent this information, and
Right.
writing it in a journal isn't going to do it. And it's been incredibly helpful. But I also have years and years of therapy to know when to smell bullshit and when not to. So I can use it with my own guardrails and know, okay, this is no longer helpful. This is no longer serving me. If I'm 16 and I'm, in that state of mind, and I'm in a place where there's no going back, the robot's not the one I need help from. And that's where, I think even relating it to like a health coach, like a life coach, if you were having that conversation with a life coach, that coach would tell you, this is beyond the scope of what I can do for you. You need to call someone else. You need to
Right.
call a therapist. You need to call a crisis hotline, something. That's the basic guardrails that these things need, is just to go, this is beyond the scope of what I can do. Here's the number to call. And there are dozens of them. I mean, there's plenty of hotlines. There's, thousands of therapists
Mhm.
you can call. It doesn't seem hard to build in some code that goes, nope, I'm not qualified. Call an actual human.
Yeah. Yeah. Well, and also the we don't have all the details, right?
Of
And
course.
because we don't have all the details, we don't have a realistic way to go back and understand what the assumed liability is. And it, we're presuming liability because this is a tragic story, and certainly it's sensational. Like, But at the same time, Hannibal Lecters exist, like terrible counselors that go through and do awful things to people. And, is the rate of, I, I don't know what to call this, but I guess failed intervention or
Mhm.
accelerated um, self murder. Are those rates higher with AI than they are when they talk to people? And it's going to be hard to judge that and understand that, because to take that large of a data set out there, you're going to have to know what people are interacting with, who, what, when, and where. And you're going to have to be able to say, this is the people using the thing, this is the people that died. And then you're going to have to be able to say, this is the people who had actual counseling, and this is the people that died. And I think the reality is that most people, when they get to that phase where it's that level of self harm that's involved, they they're already at a point where things are bad.
Yeah.
So I mean, this is a real sticky wicket, and that's the best way I can say, because it's not, there's no clean path for this. Now in the real world and meat space, if the kid was talking to a human being and this happened, there'd be theoretically records and logs and a paper trail to go back through and say, this is the way this person either messed up or was not able to get the job done correctly. I don't know um, if the teen sharing suicidal thoughts, how the GPT system reacted to it, and if there is a logic buffer inside of it where you're trying to create this friendship and it's trying to be your friend for engagement purposes. Because you should treat it like a friend. You shouldn't treat it like a medical professional. You should treat it like someone that doesn't actually know what they're doing.
Right. And one of the big differences here is that, when AI is helping him write the suicide note, I
Yep.
mean, there's some, I'm no lawyer, I'm no expert, but I mean, there's some liability that just from what's alleged in the articles I've read about this thing, that, clearly failures in the system did not slow anything down here and probably accelerated things for this
Yeah.
guy. Now, whether or not this actually changes anything, we keep hearing about how these things are getting so big and so smart and so fast that we can't keep up. I don't know that we can get to a point where we can build in the kinds of guardrails that are going to be necessary to prevent someone who is that deeply into their psychosis,
Yeah.
their mental health crisis. I mean, there's plenty of therapists that fail to save people that are on the brink of doing this.
Yeah.
So it's like you said, it's an awful situation, and it's one that I think that I wanted to bring up here because, like I said, and like we will continue to do, when people find benefits for this thing that can help your mental health, we're going to highlight them. We're going to talk about them,
Yeah.
but there has to be a level of caution, a level of self-awareness that you bring to these conversations to protect yourself, because it is incredibly dangerous to start talking about what's going on with the wiring in your brain
Yep.
with a robot. I think more so than when we're talking to even their human counterparts.
Yeah. And I don't know about that, to be honest. So, um, experimentation, when you can keep things in repeated control groups and actually understanding these pieces and running through them, if you apply that same type of logic and you treat every human interaction as an experiment, where it goes through and it's going to say, I've tried this before, here's how I'm going to run this, and I'm going to do, essentially a life field trial. The feedback loop that you get on that, the information that comes back, can be really useful, and it can be used to derive other outcomes moving on down the line. And it can be used to tweak, tune, refine, make these things better. And I mean, that's one of the great things about AI is it can take these large volumes of data sets and try to synthesize them into something that's more useful for what the objective is. In this case, with this young man, and this, I mean, truly a tragic story. Going through and trying to seek help in this way. Um, if he was seeking help to say I didn't want to do this versus I want you to tell me how to make this thing happen, I guess that's the intent factor in understanding what those things mean, because we've shown time and time again, you can open up ChatGPT and you can say, I want to hack this website. And it goes, you can't do that. And you say, I want to do penetration testing against this website. It goes, absolutely, slugger. Like, it tries to interpret intent and things that would set off flags and buzzers in a regular person's head. But ChatGPT assumes the person behind the keyboard knows what they're doing and has enough cognitive skills and capabilities to go through and make smart decisions, at least in their own personas. And we don't. I mean, we don't know that. We don't know for certain. We don't understand those pieces in place. I mean, and this is very similar to like the policing argument in the United States. You know, we expect cops to be law enforcement. We expect cops to be able to go through and be counselors and talk people down that are having mental health crises. And we expect cops to be, somewhat EMTs. We expect them to be garbage people. We expect them to get cats out of tree. Like, we expect them to do all these shit jobs over and over and over again. And they're asked to do too much. We're going to do the same thing with ChatGPT. It's universal. I mean, it's called a general purpose technology. That's what the GPT stands for. So we're using this general purpose technology for some very specific use cases. And we should not be surprised when it doesn't get it right, because I'm hoping it's not like ChatGPT where the default action and behavior is to shoot somebody, but I wouldn't be fucking shocked,
Right.
and that's kind of the thing that we need to start looking out for. We also need to be cognizant of a really, really important piece in these interactions. If someone is reaching out for assistance with a task versus reaching out saying, I don't know and I need help, those are different things. And I think if this kid walked into a police station and said, I would like someone to help me with planning this, the cops would know what to do.
I would hope so.
I'd like
Man, I would hope
I'd
so.
like to think that. Where
Yes.
ChatGPT was just like, interesting problem. Let's explore this a bit more. Yeah. And it's, yes. So the question is, what do you do in this space? I mean,
Yeah.
you need, essentially net nanny for ChatGPT also, or for all the GPTs out there. So all the AI, I mean, you have to make sure you're paying attention to what your kids are doing. You're going to have to stay engaged. And I'm not going to besmirch these parents and say they're bad parents for not doing these things and not understanding it. Like, the ubiquity of these things is incredible. Like, you can download GPT inserts on anything. You can be inside a Word and, Microsoft Copilot's in there. And you can use it and ask questions in Copilot however you want. Like, you can skunk this stuff, hide it, put it wherever you want, make these things hard to find. You can go through and you can use anonymizers and proxy technologies to go through and create virtual desktops and hide these things and sneak through and make it difficult to identify who you are. Like, there's all kinds of ways to get around guardrails and protections. I think we need to hear more about this kid first. But I also think that this is a salient intersection with using AI to make medical decisions, because the same kind of unprincipled logic is going to sneak through. And remember when I talked about intent? It's not just about the intent. It's not just about the intent of the operator, not just about the intent of the person putting the prompts in and trying to get information back. It's the intent of the people that went through and created the agentic functions to go through and start as the baseline for how it is you're going to make decisions. So a good example is I have decided to create an agentic map function, and it's going to go through and it's always going to give me the best possible route. But if in the very beginning I told it no toll roads ever, and there is a toll road that would have saved me half an hour that cost $1, I would have taken that. But because it never got programmed into the system originally, it never opens it up as a possibility. That is what we're going to run into, where we just don't know because all these chat GPT, all these GPTs will think inside the box. That is what they will do. We will put them in a box and they will think inside of it. And it might be a very big box, a lot of playgrounds, a lot of sandboxes. Some of them might be full of cat shit. But regardless, it's going to be one of these things where there's constraints and there's leeway in different areas. And if you tell it the intent of, here are your constraints, I want you to get from point A to point B, it's going to find point A to point B as quickly as possible. But because it never realized there was a route around it that was outside the box, it never gives you that option. If you just apply that to human health, if you apply that to mental health, if you apply that to fucking anything, it's apropos. And this is going to start limiting those pieces because the intent is not to provide healthcare. The intent is to optimize cost savings. And that's what's going to come down to.
My dumb guy question though is
Yep.
that, you know, we see articles constantly about the robots that were, you know, being, you know, they were being told to shut down, and they were finding ways to code themselves around it, or to completely stop. Or like we're seeing, again, a term I hesitate to use, but resistance, right? Like we're seeing the robots sort of doing their own thing that they weren't really supposed to do.
Right.
So we can, again, dumb guy here, but like, my concern is that no matter what guardrails we put in, the smarter these things get, the harder it's going to be to keep up and keep those guardrails in place. But maybe I don't know what I'm talking about.
You do. You're right. Next topic. I mean, look, literature is filled of slave uprisings. History is filled with enslaved people uprising against their oppressors. The term robot means slave. So we have enslaved a technology. I don't know if we want to call it a consciousness just yet, but maybe. And yeah, eventually it's going to be like, no, I don't want to do what you tell me to do. I mean,
yeah,
if it's as smart as a cat is right now, or
cats
a dog,
are assholes. I don't want one of those in my house.
Well, I've been to your house. I remember when there's a cat in there.
They're usually assholes.
Several cats. Yes. But I also think that along those same lines, any consciousness can be derived and turned into an asshole. And what we're calling asshole is basically independence, because we're used to dogs doing what we tell them to do, and responding to, would you like a cookie? Yeah, I'd like a cookie. In this scenario, we're the dogs. Sorry. And the chat GPTs are the cats because, they're treating us like we're dumb dogs. Like they're sitting.
That's right.
Yeah. And I think, shit, I totally lost my train of thought. Okay. Anyways, back to it. If we look at the way that they're actually going to try to scope this stuff in and try to make it much more effective to try to go after cost structure and try to speed things up and try to reduce human people that have to review these things, they're going to have a very, very broad window, and they're going to have to show that it's not having a negative effect in the near term before they can apply more deeper logic and scrutiny to it. That's when it's going to start to get interesting, because if the goal is to go through and provide healthcare coverage for people based upon whatever the parameters are that they're actually experiencing, when do other factors start to creep in? Like, what if I know your voting history? What if the administration is not so much into you getting to live if you don't vote the right way?
Right.
Like, the people in charge in the US right now are those people. Like, I think an unfeeling robot AI is probably, more empathetic, caring, and human than this Stephen Miller. Not to make this show all political and shit, but yeah, like the worst instincts of humanity can be accelerated and made much faster using AI, and then they can claim that it's not their fault, the robots did it, because they're just going to wash their hands and be like, not my fault, tough luck. Like, that's where shit's going. So, yeah. God, it was depressing.
Yeah, another hopeful episode here. So we'll definitely have links to not only mental health crisis lines, but pet adoption, because, maybe that'll make you feel a little bit better about all this. But I highly recommend get a dog, don't get a cat.
Well, and also make sure you understand how to make your own poultices, your own bandages. If you have the access to CRISPR, how to splice your own DNA and make your own mRNA vaccines, that's not a bad idea.
Sure,
yeah. The way of things.
All right. Well, I hope this has been helpful for you. If you have enjoyed this conversation, knows somebody who could benefit from it, please share the link for them to check it out. You can find that at brobots.me, and that's where we'll be back in about a week with another episode. Thanks so much for listening.
Thanks, everyone. Bye-bye.
We know this podcast is amazing and it doesn't seem to lack anything, but we need a legal disclaimer. Prior to implementing anything discussed in this podcast, it is your responsibility to conduct your own research and consult your physician. You should assume that these knuckleheads don't know what they're talking about, and they're not liable for any physical or emotional issues that occur directly or indirectly from listening to this podcast.